Exercise is highly recommended by mental health professionals as a valuable tool for managing symptoms and improving overall well being. Exercise releases endorphins, the brain's natural feel good chemicals, enabling you to have a mood boost. This elevation of mood can help you combat depression and reduce anxiety. Through exercise, you can reduce the amount of stress by lowering cortisol levels. Cortisol refers to stress hormones. Through lowering the amount of cortisol within the body, you can also be more relaxed and attain emotional stability. Exercise will also increase your energy substantially, especially when there is a lack of it during a depressed state. When depressed, we usually feel fatigued and have low motivation. Exercise will help you fight fatigue and allow you to be more willing to engage in daily activities, enabling you to enjoy life. As I mentioned, depression can negatively impact one's cognition. This can be very stressful and act as a handicap for those who are bipolar. Exercise will provide brain power. It can improve overall cognitive function, memory, and focus. It will also help people to decrease mood swings as well. Completing an exercise routine will also give you a sense of accomplishment, allowing you to challenge yourself to pursue other tasks, something which is needed when in a depressed state. Especially when you are depressed, it is necessary that you apply marginal adjustments to your exercise routines. You should start slow and gradually increase the intensity and duration of your workouts. Since your body is usually lethargic and feels heavy when we are depressed, we should not expect ourselves to do the same kind and amount of exercise that we would do when we are healthy. Therefore, when we are depressed, we should have different standards than when we are healthy when it comes to exercise. If we can't run, we should walk. If we can't play a pickup game of basketball, we should practice shooting on our own. If we can't lift heavy, we should lift lighter weights. The key here is to readjust and lower your standards to a degree in which you can exercise consistently. I highly recommend doing some sort of exercise every day, even though you may start out by doing a little or less than you would normally do. I say every day because I've found it easier to exercise consistently in comparison to exercising 3 or 4 times a week. When exercising less than 7 times a week, there's a tendency in which we will procrastinate with our exercise if we don't feel good or something comes up in our schedule, making us delay our workouts continuously. When we make it mandatory to do some sort of exercise every day, we don't have a choice but to stick to getting a workout session in daily. We shouldn't have the room in our minds to contemplate whether we should or shouldn't. Of course, marginal adjustments can be applied here. If you haven't been exercising for weeks or even months, it will be better to start off by trying to exercise every other day, for instance. This can include walking, playing sports, jogging, yoga, Pilates, and working out in the gym. I've come across many people who are able to overcome their depression and maintain stability through doing exercise, many of whom would do so every day. The exercise that I recommend the most for depressed people is walking. Walking is simple and easy and something you can manage to do every day. It gets your blood flowing and oxygen circulating, which makes you more energized and refreshed. This exercise will reduce stress and anxiety, promote sleep, enhance memory and focus, help you lose weight, and come out of your depression sooner. It can be immensely hard to even walk during stages of depression, but once you get into the habit of walking every day, you'll have a sense of accomplishment and will have more energy and discipline to pursue tasks during the day. When I would prefer to run when I'm not depressed, I try to walk as often as I can to feel better physically, mentally, and emotionally. It is one of the top advice I would give to bipolar people to overcome depressive phases.